All right, we're going to demonstrate the osteology of the shoulder girdle on the skeleton. And so, of course, we're going to start with the sternum, which is just located in the mid thorax. And we know that's a landmark for CPR, so that's hopefully something we can all find pretty easily. The upper most superior portion of the sternum is called the manubrium. The detail on our skeleton is not as great as some detail that you will see. Manubrium is the Latin for shield, and it's sort of shaped like a little shield, if you want to think of it this way. The xiphoid process is the inferior portion, xiphoid in Latin means sword shaped. So it's the shield and the sword, if you want to think of it that way. The body is the attachment point for ribs 2 through 7. And there are also attachments for the pec major all along the sternum. So it's a big flat bone, lots of attachments. So the clavicle is the S-shaped bone linking the scapula to the sternum. At the scapula end here, it attaches to the acromion process at the acromioclavicular joint. At the sternum end, it attaches to the manubrium at the sternoclavicular joint. So our skeleton's clavicle is not as S-shaped, maybe. Maybe if you look at it from a different angle, you'll see that it's more S-shaped. But the sternoclavicular joint is the main point of attachment for the upper extremity to the body, bony attachment. There are muscular attachments, certainly. So the scapula itself, we're going to turn the skeleton around so we can see the scapula. Of course, the scapula on our skeleton is bolted to the back by these little bolts. And so we can't disarticulate it and look at it that way, but we're going to do our best here. The scapula is triangular shaped. It's highly mobile, lots of attachment sites for muscles along the spine, along the medial and lateral borders. The other name for the medial and lateral borders are the vertebral, next to the vertebrae, and the axial border next to the axilla, which is, of course, the name for the armpit. On the posterior side of the sternum, which is really all we're going to be able to look at because we can't disarticulate the sternum from this skeleton. Underneath the spine, so this is the spine of the scapula, it laterally ends in the acromion process, which articulates with the clavicle, forming the acromioclavicular joint. Inferior to the spine of the scapula is the infraspinous fossa, or it's also called the infraspinatus fossa. That's where the infraspinatus and the teres minor attach on the scapula, and then they go up to the greater tubercle of the humerus as part of the rotator cuff group. They are external rotators of the humerus, and then they also do their part in the rotator cuff group. Superior to the spine of the scapula is the supraspinous fossa or the supraspinatus fossa, and the supraspinatus lives in that. Its origin is there, and it also goes out underneath the subacromial arch and attaches to the head of the humerus. So on the anterior side of the scapula, which we can't really see with this skeleton, we can see it a little bit if we look at it from the angle in this portion anterior between facing the ribs is the subscapularis fossa or subscapular fossa. That's where the subscapularis and the serratus anterior are. The subscapularis is attached to the scapula and then goes up and attaches to the humerus. The serratus anterior is anterior to the subscapularis, attaches along the medial border of the scapula, and then comes out and attaches on the ribs. Okay, so the glenoid fossa, I'm going to remove the skeleton's arm just so we can look at the glenoid fossa. And we'll look at the subacromial space too. So, sorry, Skelly. There's your arm. So, this is the glenoid fossa. It is pretty shallow as compared to the acetabulum. And so there's a labrum, a ring of connective tissue that deepens the socket a little bit. This anterior projection of the scapula is called the coracoid process. There are several muscles that attach on the coracoid process. It's the pec minor attaches there and goes down to the ribs. The short head of the biceps tendon attaches there as well. So you can see from this angle straight through the subacromial space into that supraspinous fossa. There are a lot of ligaments normally. Of course, our guy doesn't have ligaments, but there are ligaments attaching the scapula to the acromion and to the clavicle to prevent posterior and inferior dislocation of the scapula. So most of the ligaments that attach to the AC joint are preventing dislocation of the scapula. That's their major reason for living. So in the glenoid fossa, which again you can't really see very well in our skeleton because it's small, there's not as much room for detail, there are tubercles at the top, the superior portion of the glenoid fossa, and the inferior, and they're called the superior and inferior glenoid tubercles. And there are muscle attachments there as well. So the acromion process is really the part that we feel on the tip of our shoulder. And that is a broad, flat projection of bone, and it forms the functional roof over the humeral head, and it protects the structures that go through there. Of course, if you have shoulder dysfunction, you can get impingement underneath that subacromial space. So in the next section, we'll talk about the landmarks on the humerus.